This hormone medication is called Estrace Cream with Applicator. It is used by women to help reduce vaginal symptoms of menopause, such as vaginal dryness, burning, and itching. These symptoms occur when the body produces less estrogen. When treating only vaginal symptoms of menopause, it is recommended to use products applied directly inside the vagina, like this medication. Estrogens that are taken by mouth, absorbed through the skin, or injected may have greater risks of side effects due to more estrogen being absorbed. It is important to use this medication as directed by your doctor and to discuss any concerns or questions you may have about its use. The recommended dosage and optimal timing for the use of this medication should be discussed with your healthcare provider. Before you start using Estrace Cream with Applicator, be sure to read the patient information leaflet provided by your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist for clarification. It's important to use this medication as directed by your doctor. Fill the applicator with the medication according to the directions and insert it high into the vagina, then press the plunger to release the medication. After each use, be sure to clean the applicator with warm soapy water and rinse it well, but do not boil or use hot water. The dosage of Estrace Cream with Applicator is based on your medical condition and your response to treatment. Be sure to use this medication regularly to get the most benefit from it, and follow your dosing schedule carefully. Do not increase your dose or use this medication more often or for a longer time than directed. If your condition does not improve or worsens, be sure to tell your doctor. Some common side effects of Estrace Cream with Applicator include nausea, bloating, breast tenderness, headache, and weight changes. If these effects persist or worsen, it's important to inform your doctor or pharmacist. However, it's important to remember that your doctor has prescribed this medication because they have determined that the benefit to you outweighs the risk of potential side effects. Many people using this medication do not experience serious side effects. You should contact your doctor immediately if you experience any serious side effects, such as nausea/vomiting that doesn't stop, mental/mood changes, breast lumps, unusual vaginal bleeding, increased or new vaginal irritation, severe abdominal pain, yellowing eyes/skin, swelling hands/ankles/feet, or increased thirst/urination. This medication may also rarely cause serious problems from blood clots, so it's important to seek medical help right away if you experience symptoms such as chest pain, sudden/severe headache, weakness on one side of the body, trouble speaking, sudden vision changes, or trouble breathing. While a serious allergic reaction to this product is rare, it's important to seek medical help if you notice any symptoms of an allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, it's important to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. If you are in Canada, you can report side effects to Health Canada at 1-866-234-2345. Estrogens, whether used alone or with another hormone, have the potential to cause serious side effects. It is important to discuss the risks and benefits of hormone treatment with your doctor, as estrogens should not be used to prevent heart disease or dementia. There is an increased risk of cancer of the uterus, endometrial cancer, with estrogen use, but taking a progestin as directed by your doctor can help decrease this risk. If you experience any unusual vaginal bleeding, be sure to inform your doctor right away. In postmenopausal women, estrogens, with or without a progestin, can increase the risk of cancer of the breast/ovaries, stroke, dementia, and serious blood clots. When used with a progestin, estrogens can also increase the risk of heart disease, such as heart attacks. The risk for serious side effects may depend on the dose of estrogen and the length of time it is used. It is important to use this medication at the lowest effective dose and for the shortest amount of time. Regular checkups with your doctor are necessary to determine if you still need to use this medication. If you will be using this medication long-term, you should have regular complete physical exams as directed by your doctor. See also Notes section. Before using this medication, it's important to talk to your doctor or pharmacist about any allergies you may have or any other medications you are taking. This product may contain inactive ingredients that could cause allergic reactions or other issues. It's also crucial to discuss your medical history with your doctor or pharmacist, especially if you have a history of certain cancers, blood clots, heart disease, liver or kidney disease, high blood pressure, diabetes, or other health conditions. Additionally, if you are a smoker, it's important to note that using this medication while smoking can increase your risk of certain health issues. If you have recently had surgery or will be immobile for a long period, you may need to stop this medication temporarily or take special precautions to prevent blood clots. It's also important to limit your time in the sun and use sunscreen while using this medication, as it may cause dark areas on the skin. Furthermore, if you are nearsighted or wear contact lenses, this medication may cause vision problems, so it's essential to contact your eye doctor if you experience any issues. Additionally, some estrogen products can weaken rubber products such as condoms, so it's important to consult your pharmacist if you are unsure about your product. It's important to note that this medication should not be used during pregnancy, as it can harm the baby. If you are pregnant or breastfeeding, it's crucial to consult your doctor before using this medication. When using Estrace Cream with Applicator, it is important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor. Some products that may interact with Estrace Cream with Applicator include aromatase inhibitors, fezolinetant, fulvestrant, aspemifene, raloxifene, tamoxifen, toremifene, and tranexamic acid. It's important to be aware of these potential interactions and discuss them with your healthcare provider. Additionally, Estrace Cream with Applicator may interfere with certain lab tests, such as the metirapone test, which could lead to false test results. It's important to inform lab personnel and all your doctors that you are using this medication to ensure that accurate test results are obtained. As always, it's important to follow your doctor's recommendations and to communicate any concerns or questions you may have about using Estrace Cream with Applicator. If this medication is accidentally swallowed, it can be harmful. If someone has taken too much and is experiencing serious symptoms such as fainting or difficulty breathing, it is important to seek immediate medical attention by calling 911 or contacting a poison control center. Symptoms of an overdose may include severe nausea, vomiting, and unusual vaginal bleeding. It is crucial to take this medication exactly as prescribed and to store it out of the reach of children. Always follow the dosage instructions provided by your healthcare professional. Estrace Cream with Applicator should be used at the same time each day, and it is best to apply it before going to bed. Remember to wash your hands before and after applying the cream, and avoid using it on irritated skin. Be sure to discuss any concerns or questions with your doctor. It's important to remember not to share this medication with others. While using Estrace Cream with Applicator, it's essential to have regular physical exams and medical tests, including blood pressure, breast exams, pelvic exams, and pap smears. Follow your doctor's instructions for examining your breasts and report any lumps right away. Make sure to keep all medical and lab appointments and consult your doctor for more details. Preventing or controlling high blood pressure, high cholesterol, and diabetes can help reduce your chances of heart disease and stroke. Lifestyle changes, such as reducing stress, eating a low-fat/salt diet, losing weight if overweight, exercising regularly, and stopping smoking, can help control or prevent these diseases. Keeping your mind active with mental exercises, like reading and solving crossword puzzles, can also help prevent dementia. It's important to talk to your doctor about lifestyle changes that might benefit you. If you forget to use Estrace Cream with Applicator, apply it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Use the next dose at the usual time. Do not apply double the dose to make up for the missed one. Make sure to store the Estrace Cream with Applicator at room temperature and away from children and pets. It's important not to flush the medication down the toilet or pour it into a drain unless specifically instructed. When the product is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal of the medication. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.